Yeah, I mean, it's very important for all of us to understand that this is still a new technology. Obviously, we're learning more and more about it. We have seen multiple cases today. As I mentioned, this is a new technology up and coming. Dealing with calcium is becoming a day-to-day practice for all of us because of the kind of patient that we're seeing with people living longer, multiple comorbidities, etc. So this is an additional tool to our armamentarium. Of course, if you look at any I think it has multiple advantages. As you saw, it's very deliverable. You could use it multiple times. You could use it in many, many lesions. And the majority of us that have been using it now for a bit, we have used it in multiple, and we made many inflations without any problem. It is quite effective. If you look at all the other technology, rotablation, orbital atherectomy, it does have a certain technique. It does have a special wire and so on. So it does require lots of experience and extra effort. If you look at the IVL, the shockwave, it has a limited amount of energy. This one, it is just a normal balloon, which we are used to on a day-to-day basis. So it kind of gives us some advantages because you could use it many times. Problems. And I think I would invite all of you, to be honest, to be able to try this technology and use it and get your hands on it and see, because it's easy to use, easy to learn. And because it's a balloon, what we use on a day-to-day basis, I think it gives you a lot of advantages. Of course, all these techniques do have cost incurred with them, and whatever it is the fact that you could use it in multiple lesions, multiple arteries, and you do not require many other, because with IVL, for instance, shockwave, it's only 120 pulses, and if it runs out and you still have long lesion, you might need another balloon. This is one balloon can treat all the arteries and so on. So there are some advantages, and we are still learning. It is an early learning curve for all of us. We're building this experience, but everything seems to be very promising. And I think for people who haven't seen it, it's probably time to try to see if this will fit into your practice day to day, because I think it's quite a very promising technique.